On this segment, we'll be discussing maternal mortality, the clinical and social causes, and how they can be averted. I can't believe we're still discussing maternal mortality in 2024. Yeah. Well, joining us on the show is Professor of Obstetrics and Gynecology at the College of Medicine, University of Lagos, CMUL Lagos, Professor Bosede Afolabi. Welcome to the show, madam.
Thank you very much. Thank you for having me.
Good morning. So, whenever we talk about issues concerning maternal mortality, we always assume that there's a lot of awareness out there. People just supposed to know what to do. Doctors, there's information out there, but the fact that we're still discussing it seems like it's still not enough. Could you give us an overview of what the maternal mortality numbers are today in Nigeria and how we're faring?
Thank you very much for that question. So, maternal mortality is still too high. That's the bottom line. But there are several figures. There are figures from a demographic health survey in Nigeria. There are figures from the World Bank, WHO group. And whatever the figures you look at, they're too high. So for the recent 2020 World Bank, WHO, UNICEF group, it was given as 1,047 per 100,000 women. Live births is the maternal mortality ratio. In simple terms, that means that the total number of women who died generally all over the world was about 247,000. And from Nigeria contributed 82,000.
What?
So
that's a lot of
147,000. Yes, that's about a third.
Yeah.
Yes. So, and because of our size, even though the ratio itself is the third highest in the world, the total number of women is the highest in the world from those figures.
Wow. That's alarming.
Yeah, that's alarming.
It is quite.
So, what usually causes this this death issue? Is it usually giving birth or post? Like, what exactly is the root cause?
Thanks for that question. So, the commonest causes or the commonest time, the most likely time for a woman to die is during delivery and immediately after. Although it can also happen sometime during pregnancy, but the commonest time is during delivery. And the causes, we know them. You know, the clinical causes, that is the causes due to the woman's clinical condition, are things like preeclampsia, which is a hypertensive disease of pregnancy, bleeding, postpartum hemorrhage, infections, complications of abortion, and complications of obstructed labor. So those are the commonest causes. You also have anemia in pregnancy and so on. But the social causes are delays, due to delays such that a woman doesn't get to make the decision to go to the hospital in the first place, or the second delay, which is she's made the decision, how does she get to the hospital? Transportation, areas where there is difficult to reach, referrals and so on. And then the third one is when she gets to the hospital and she doesn't get the appropriate care, either because she got there too late or because there are problems with the facilities. So there are three delay causes, and those are the social ones, and they are very important. And that's one of the things that the non-profit that I also run is trying to help reduce or address.
So would you want to tell us about this non-profit that you run that seeks to reduce? Because if we look at these times, the figures are still very high. And for some of us that have passed through motherhood, it feels like, I skilled. And some people are just having that fear to even go into it. So tell us about your system.
Thank you for that question. So I'm the founder and chairperson of the Maternal and Reproductive Health Research Collective, MRRHC for short. Okay. And what we've been trying to do, we do research, we do advocacy, we do programs and interventions to help reduce maternal and reproductive health issues generally. Regarding the maternal mortality issue specifically, over the past 1 year, we've developed a program called Mama Base, where we register pregnant women in vulnerable areas. We started with Lagos State. We plan to move, countrywide. We register vulnerable women who live in urban slums where they can't really afford much, and we link them to the primary health care centers in Lagos State that is close to them. So we're in all the communities, the local government areas in Lagos State, the 20, and we link these women to these primary health centers. Because, like I said, one of the highest time is during delivery. And a lot of these women prefer to deliver at home. Or it may be preference culturally. Sometimes it's also because they can't afford to go to hospitals, or they believe hospital is expensive, or they believe they don't get the type of care, respect when they get there. So for those reasons, we try to reassure them. We link them to community health workers So we actually employ community health workers to follow these women up. And so far, we've managed to follow up about 7,800 pregnant women.
Wow.
That's huge.
And, you know, close to... We have, but not close to us.
Fatal.
So basically, like I said, for Lagos State, the maternal mortality ratio is about 545 per 100,000. From our figures, we've got it out to 108 per 100,000. So we reduced it more than about fivefold.
Good work. I feel that many times when we talk about initiatives like this, yes, Lagos is like what we complain about in Lagos is like it's still comparable to a first world country as compared to other states in Nigeria. The kind of issues that pregnant women tend to go through when they are trying to give birth, where there are no hospitals in a 30-minute drive from where they live, nor any medical, professional medical facility around them, no medical personnel, doctor, nurse, within 30 minutes of where they live. And these are some of the reasons we have those huge numbers. Is there anything, what are the areas that the government can bring in intervention to support those people who are not close to the cities, not close to general hospital or primary healthcare centers?
So you are right about Lagos not really having a lower ratio than other states in the country. In fact, like I said, the general total in Nigeria is supposed to be 1,047. In some areas, Lagos State's figures are much less. However, there are also areas within Lagos that have, and those are sort of the areas we've been going to. But there are also sorry, the last part of your question.
Yes, I want to understand. I want us to be able to give advice to the ministers, because we have people that are in position of power who I feel if they know what to do better to address the issues, they probably will. Yeah.
So it's such a hydra-headed problem. But one of the issues of knowing where to locate, and it's one part of research that my team and I are working on in a different way, in that we're mapping the journeys of pregnant women from their homes to the nearest available health center. And we found that there are actually some areas where there's a 30 minutes or more, even up to 60 minutes drive time. And that's drive time. You can imagine if they're not driving or if they're using another form of transportation. So we did that all over the country. And for Lagos State, the Lagos State government was actually responsive enough to put maternal care centers close to one of the places where we found the greatest distance. So government Ekpe in that time. So governments can actually key into research, data.
Let me ask, do we have functional primary health centers to attend to these women? Because somebody was sending me a report that all our primary health centers across the country are just horrible. People don't use them. Nobody wants to use them, and that's what the problem. Is that still a problem, or are they being worked on so far?
You know how it is. We tend to be rather negative about everything. That's without doubt. And yes, there's a lot that needs to change, but there are a lot of renovated and rehabilitated primary health centers. The problem is, of course, there are some that are also not good. But a large majority are quite good, especially in somewhere like Lagos. The problem is that women do not trust. Also because of that, initial negativity. There's also that issue of the lack of respectful maternity care. And that's one of the things we're training from my organization. To say, look, everybody from the gate man to the person who's actually going to deliver this woman, it's a very, tender time, fragile time. You need that care, you need that, concern.
Okay, I remember that about 2 years ago, Honorable Shino Pella, he did something similar in his constituency. He provided ambulance keke, napep. And when he came under criticism, he said, this is the easiest form of transportation to get to the nearest healthcare center, especially emphasizing on pregnant women and this delay time. Do you think it's something that the government or other senators should key into, looking at alternative means, considering drive time, Lagos, traffic, and all of that?
I think it's important to take everywhere into consideration, all your contexts. So, for example, I went to a place, we did an outreach, and this place could only be accessed by taking a canoe within Lagos State. And, there was water between it and the nearest land area. So, for that reason, you would need a boat in that area.
But the ambulance would be a boat.
Exactly. And there are some areas where the terrain is so bad that you do need to take, have a NAPEP to make it quicker. And you can actually adapt these NAPEPs to have an ambulance bed. There have been some made in other countries where they have similar problems. So it's to go with one's context.
I'm always really concerned about maternal mortality or hospital-related challenges, and I feel that sometimes a lot of our leaders just throw money at the issues, building facilities, gigantic facilities, as opposed to providing intervention. And just for public knowledge, I've done my family planning over the past 3 years through the primary healthcare center right close to this place in Oregon. It's a very easily accessible place. It is completely free to do family planning there. Removal, putting it back, you're not paying a dime. Fantastic. And they provide, even if you want to get drugs, they give you the drugs there cheap. And I've been there. I was still there this year. I was there last year. So please visit our primary healthcare centers. They work. But you mentioned research. How would you evaluate the importance of governments using research to bring in their intervention?
So that's so key. If you create something or if you carry out an intervention, if you do not evaluate it and you don't know the impact, then you haven't done anything really. For example, if we didn't realize that, okay, what are the maternal mortality figures? And now look at the births that we've had and look at those women who still died from it, we wouldn't know that we've had an impact. It is key to have monitoring and evaluation at the backbone of every type of intervention or research that you carry out. That's the only way you can know whether you're improving and how to improve.
We have to wrap up with you, but
okay, now I just wanted to ask that if from the things you mentioned that causes mortality during birth, is there a way, because these women go for their maternity checks and the antenatals, is there a way that they can spotlight or see those things before it actually happens? Yes, before it gets complicated.
Yes, that's why antenatal is also important. Unfortunately, maybe about 60% of women, in Nigeria would have at least 4 antenatals. And even worse, delivery figures, about 30-something% of women, less than 40% of women would deliver in a skilled healthcare setting. But if you go to appropriate antenatal care settings, yes, you get the information that is required and, you'll be able to...
Thank you very much, Professor, for coming. It was important for us to just remind ourselves the importance of maternal mortality and how we should reduce the mortality rate of women dying. But thank you so much for shedding more light on it.
Thank you.
Let's go on a short break. When we come back from our hot topics, stay with us. We'll be right back.
Stay tuned. Your View will be right back.